Hello, Dr. Corrales.
Well, hello, Nurse Wendy. Is there a reason why we have this audience sitting there looking at us talking?
Good question, Doctor. This is Mrs. Bafaluco's class. Well, that is kind of a hard last name to pronounce. I am going to change it to Mrs. B. or Carol's healthcare delivery class.
Can you get to the point, Nurse Wendy?
Did someone forget to have their coffee this morning?
No. My wife made me sleep on the couch last night, but that is a whole other can of worms.
I'm sorry to hear that. I'm sure she just did not want you taking the whole bed space.
Can we just get to the point with this?
Oh yes. So like I was saying, this is Carol's healthcare delivery class. They're here wanting information on the impact of healthcare cost on access to care for the homeless people.
Do you mean unwealthy?
Yes, doctor. Also, they were wondering to get information on the impact of healthcare cost on service delivery for the homeless. Doctor, in your words, unwealthy people.
Sure, I can answer those questions. By the way, Nurse Wendy, I should inform you to cross your legs. That is not very ladylike of you.
Oh my God, I assure you that I am wearing underwear.
This is getting sort of awkward. Well, so Mrs. Bafaluco's class, I am a rheumatologist doctor. I am going to inform you all on the impact of healthcare cost on access care for the unwealthy. So first and foremost, the homeless people are at high risk for chronic and severe health problems due to the environment they live in.
I agree with him, class.
Thanks, Nurse Wendy. Also, the life expectancy for homeless people are far lower than the general population.
Can you get to the question, doctor? We have only minutes before we lose their attention.
Yes, Nurse Wendy. Class, as I was saying, with homeless people being at high risk for medical issues, and now that healthcare cost is rising nationwide. Healthcare for the homeless is available, but it could be quite difficult for the homeless to be treated with the same standards.
Do you mean they won't be getting the same meals?
No, Nurse Wendy. What I was referring to is, if the homeless needed further follow-up, the copay would be difficult to be met. Or getting the appropriate equipment might also be a challenge to be purchased by the homeless. And possibly waiting around to be approved by Medicaid are just some of the issues. See, class, the impact on the homeless for access to care is a negative outcome, even though they would most likely be approved for Medicaid, but being sure that they would be compliant with the standards protocol, that is, having a valid address, attending meetings to stay insured by Medicaid insurance, and being able to afford what the Medicaid would not be able to provide.
Again, you are right, but Dr. Corrales, what about the impact on the homeless that might need service delivery and health care?
Class, this approach can be either negative or positive depending at what way you are looking at it.
Doctor, can you please explain that?
Yes, I can. The impact on healthcare and service delivery is an improvement. Pay attention, Nurse Wendy, and Mrs. Bafaluco's class. One positive outcome of higher cost in healthcare pushed more providers to take the electronic approach for patients' records. This strategy is more efficient and will help the medical staff to not duplicate X-rays and other tests that are in medical records for the patients being treated.
And this outcome implies to the homeless how?
Ha ha ha, is someone getting impatient?
Who? Me?
Yes, Nurse Wendy. However, this impacts the duplicate's cost of X-rays, labs and other tests to be held if not already in patients' records.
And the way that issue becomes negative is how?
Well, that goes back to the funds that needs to be met by the homeless. You see, regardless how you look at it, having the cost rising in healthcare makes issues for the community to be met.
Oh, I see. So, there you have it, healthcare to delivery class. The impact to healthcare cost for access to care and service delivery for the homeless is a negative outcome. Well, Dr. Corrales, what was that for?
You said we had only minutes before we lose their attention.
Oh, in that case.
Goodbye, Mrs. Bafaluco's class.